My clinical question was, why don't patients take their antihypertensive medications? This was my initial concept map that I created. As you can see in the middle, it says non-adherence to antihypertensive medications. And around that bubble are um, things like why people might not take their medications. One would be like health literacy, side effects of the medication, the cost of the medication in general, not altering their lifestyle, they're in denial of having hypertension, or they just take so many medications that they forget to take them all. So why is my clinical question important? Well, hypertension is defined as blood pressure equal to or greater than 130/80, CDC 2021. Of adults, nearly half have hypertension or are taking a medication to treat hypertension, CDC 2021. So having hypertension puts an adult at a higher risk of having a stroke or developing heart disease, which is the leading cause of death in adults in the United States, CDC 2021. Not only can people with uncontrolled hypertension develop heart disease, but they also can develop complications of heart disease, such as heart failure, stroke, renal impairments, and blindness for diabetics. A.B. Gaz et al., 2017. By 2025 globally, the number of people to be diagnosed with hypertension is to increase by 30%. Elgaz et al., 2017. So some reasons why people might not adhere to taking their antihypertension medications are they may experience some adverse effects from the medications such as vertigo, dry cough, fatigue, and weakness. They might even be scared of the long-term effects of being on the medication, such as a stroke or kidney damage, which is Peters et al. 2022. So the theory that I decided to use with my clinical question was Orm's self-care deficit theory, and this theory focuses on the nurse assisting patients by teaching, guiding, and supporting the patient in a developmental environment, Hartwig 2020. So why I decided to use this theory was I was be you could be able to determine what the patients were deficient in, which in this case was not taking their medications. And then you would be able to develop interventions that could be implemented to help them improve taking their medications and to reduce any like adverse side effects from developing. And this theory is great in helping patients create short-term goals that can later turn into long-term ones that can help them adhere to their medication regimen. So this was the theory-informed concept map that I decided to create. As you can see in the middle, it says the deficit, which was the patient not taking their antihypertensive medications. And the things around it are what can help the patient um, get to the outcome, which was improved adherence to hypertension medication. Some things that can help them with get to their outcome would be talk about like the negative consequences for not taking their medications. The nurse educate the patient on the importance of taking their antihypertensives. Create programs about the importance of adhering to their medications. Just general reminders to take their medication, and just have them gain more knowledge about the side effects of the medications and hypertension in general. So some anticipated outcomes from applying the evidence-based strategies. As many patients do not adhere to their antihypertensive medications because of fear or the complications from the medication of practice can change that would be recommended would be for providers to emphasize the negative effects that patients can have if they have uncontrolled or poorly controlled blood pressure. Shirley et al. 2022. So just education about the importance to take medications, talk about the side effects of the medications, refill reminders from the pharmacy that like their prescription needs to be filled, or just even reminders to take the medication in general by using pill organizers or smart pill bottles can help them adhere to their medications. As you can see over here on the right, these are smart pill bottles, which I thought were really cool. They connect to your phone so they can give you reminders of when to take your medication. Um, the final takeaway that I would want all you guys to take away from my presentation would be just education, education, education. There's just so many people out there that are not educated about the importance of taking their medications, and just educating them about that would really help them adhere to their medications. And just creating a trusting relationship with your patients so that they will be more open to you about the problems that they've been having, and that open communication can help them determine if there might be a change that's needed in the medication, such as a dosage change, or just changing the medication in general to one that would really help them. So thank you. And here are my references at the end.